And then it just go around.
Okay.
Repeat it. Or restate the question when you go to answer. That way the screening isn't there. I like the ones that just automatically change.
One in the kitchen does that. That's fabulous.
Yeah, one in the kitchen.
Are you
So this is on? Yes?
Pastor, is her mic on?
Can you hear me? Is it on?
We can't have it guys against girls.
Can you hear me? Is this on? I think so. I feel like I'm echoing.
I can hear you fine.
Okay. Well,
We have a few minutes.
okay, great.
I'll do an introduction and stuff for you.
We are live online, so watch your language, ladies.
Yes, sir.
talking about household?
I'm glad you said that.
Oh, Mary, do I need to send these to you, or will I be able to? I can comment.
I think you should be able to.
Yes, you can, otherwise you can send it to the church.
It is just, yeah.
Because I want this lower than me.
So you're saying I should just put them
Single yes comments.
So you're telling me that it's not really 11 o'clock, it's about 4 minutes to?
Yeah, now it's 2 minutes.
You guys did that, so I would set mine.
It used to be.
It doesn't work very long.
Yeah, we sped up a little bit, so, or slow down a little bit.
And I have it set perfectly, and I'm teetering on the top of a step ladder, the only one here in the church. And I'm thinking,
Not good.
idiot.
My mom used to tell me something was an hour difference. Well, I knew darn well it really was, and I'd still be late.
Why don't we go sit in the back? This is where I sit. You guys where I sit. Well, and Linda sits over there, but I have to sit over here. So, besides, you guys are over here.
Yeah.
That's what I said.
I almost have them all posted, and then I think that should sound pretty well.
No. It's true. Yeah, we don't want that. Mine's coming back. That's true. Get a coat.
I'm gonna sit closer so I can see what you got going on.
Where'd you go?
Good morning.
Good morning.
All right, well, you know me. I like to start on time, end on time. So, thanks for coming to our third in our series around the end of life. I'm going to let Cindy introduce herself here in just a moment, but I'm going to do one last sales pitch for a couple things. So one, our last session in our end of life series is next Wednesday, April 20th, the next Wednesday, the third Wednesday of April at 11 a.m., and it's around healthcare directives. So if you don't know what healthcare directives are, it'll partner nice with what Cindy's going to talk about today, but it basically is letting your loved ones know so they can act as your agent when you can't do that yourself or maybe don't want to. I'll share personally, I'm named on 3 different ones and they are drastically different. So it's really important that you communicate what you want as your wishes about your health care to your loved ones, because otherwise they really don't know what you want versus what they want, and they may not be the same. So we have a speaker who was a cancer nurse for 28 years, and now he's been retired, and he was going to do it virtually, and he's so excited to come up and do this that he's decided to come in person, so that will be nice. And then the last pitch I'm giving is mental health first aid. We're offering it free here May 3rd and May 10th. So it's 2 4-hour days. I think we're taking a break in the middle for lunch. There is a $10 cost to it because for each person there is a $175 value tied to that. So we got funding through Thrivent, and I donated my time. I've been a certified facilitator for mental health first aid for going on 5 years now. But there are supplies and such to order. So if you're interested in registering, please do so prior to our our April 20th session, and it's $10 to hold your spot so that we know how many supplies to order. And if you have any questions, feel free to let me know. Otherwise, there are flyers out there that talk about it a little bit more. Any questions for me?
There's flyers out there for next month's
Two.
class all.
Okay. So, and I'll move them over to this just while you're here, and then we can put them back over. All right.
Okay. Well, my name is Cindy Pearson. Everybody says Person because it's P-E-R-S-S-O-N, but it's really Pearson. And I have been a hospice and palliative care nurse for 30 years. I didn't choose hospice, it chose me. Little things started happening and I just realized I would do anything for anyone. And I don't know, hook, line, and sinker, I've been 30 years. And my whole heart goes out to it. So, first off, too many people hear the word hospice and think, oh, so-and-so's in hospice. You've already got them gone. Well, I like, when I do admissions, I now do admissions versus a lot of case management. I always say, I am Cindy, the crazy Viking nurse, and I'm here from hospitality. We don't speed up end of life, we don't prolong, we're with on the journey. The families and patient are chief in charge and we're there for comfort, support, guidance. A nurse has to come out once a week, but it's usually a lot more. A social worker has to do a psych social, the initial, and then once a month. But if a plan B needs to be done, they can come out daily, weekly. They're also a good person that works on the healthcare directives. So those two, Medicare says, you have to have those two in place. We also have our chaplain, non-denominational. One day he might be working with a Buddha, and the next, a Catholic or Lutheran. But their role is, yes, it is about prayers if they want it, but it's also just working with the patient on their journey and maybe setting up for a pastor or a priest to come out, okay? Home health aide, they're wonderful. They're my eyes and ears, or, everything, because I usually don't undress a patient, but they'll report to me if there's something new. They're all about personal care. They can take out the laundry, they can put laundry in and give the bath, change the linens, take the garbage out. But through Medicare, a visit is a visit is a visit. It's not like a home health aide has 2 or 3 hours, but if they put clothes in, they can maybe then put them in the dryer. But if they're done with everything else, their visit's done. I will tell you, I know too many of mine, and they'll do the little extra, but that's really however long a visit is a visit. We don't move in, but we're available 24 hours a day. Visits are made in the night, if need be. I tell people that, we're not a 911 because there's less people working at night, but you get a real person that will guide you on, you're calling in because of nausea or pain or whatever. Every patient gets a comfort kit of medications. The comfort kit, and it doesn't matter if it's Alzheimer's or cancer or congestive heart, everybody gets a narcotic. A lot of people think of morphine for pain. Well, we probably use it even more for shortness of breath. So it's pain or shortness of breath. Anytime you get a narcotic, can be constipating, so you're going to get a laxative. In fact, you're going to get suppositories and tablets. Something for anxiety, something for nausea. End of life often has kind of the gurgling secretions. They say it's not uncomfortable to the patient. Years ago, everybody called it the death rattle, and you could walk into a nursing home, and you could just really hear it. So we try to dry up what they can't bring up. A little bottle of eye drops that go in the mouth. It's actually fluid on the vocal cords, and so it's a comfort measure. Mouth gets dry, well, then we swab. Let's see what else is in there. So, yeah, those are pretty much our comfort kit. So if you call in, we've got something. You can't sleep? Oh, we've got something for that. We don't have an app, we have a med for that. We're not drug pushers, but I kind of joke with patients. I'll say, so, you know, when you need to get a script for a narcotic, sometimes it's really hard. It's hard to get out. Well, I say, we have our own drug dealers. They come right to the door. Well, fortunately, they drive a vehicle that says speedy delivery and whatever, but any medications, that's again the hospitality part, any medications related to your diagnosis, they're covered and paid through hospice. So say you had lung cancer, but you're also a diabetic. Well, your insulin wouldn't be covered by us, but you would continue to pay for it the way you always have. But anything to do with pain, breathing, nebs, oxygen, has to be covered through the hospice program. Okay, so that's, you know, kind of our home meds. Any equipment needed, hospital bed, commode, I call it the Cadillac walker, you know, the one that has the seat and all that, versus just the one around. You name it, we cover it. Our delivery for any equipment, I'm saying this, you know, obviously I am with Accent Care Fairview, got to put a plug in, but every hospice, it's funded by Medicare. If you're not Medicare and you're private insurance, it's under Medicare guidelines. You may have a copay, but usually it's pretty much covered. Medicare, everything's covered 100%. So equipment comes out within 4 hours. So we just say if you want a hospital bed, you have to move your stuff because they're not going to move yours. Have it ready and they bring it in and set it up. Teach you how to use anything. The equipment company, meds are delivered, end of day. Refills are done by mail or same day delivery, especially when it's cold. You don't want some of these liquids freezing in the Minnesota. Wound care, supplies, anything like that. It's all covered. Pull-ups, depends. Bed pads, chucks, wipes, blah, blah, blah. So I like to say, again, hospitality where we come to you, you don't have to be homebound, and that's kind of the difference. So on here I have where there's palliative care and then hospice. Well, palliative care doesn't even really need a doctor's order, but you have to be homebound because otherwise, yeah, you just don't meet criteria. With the palliative care, you can still be receiving chemo or whatever, but there is pain management, a chaplain, and a social worker who can go over healthcare directives, and then when the time comes for hospice, hospitality, then the transition is just made. So, palliative care does not have access 24 hours a day like us. So like if somebody, they could call, but if you were really having more pain, we don't have that ability to just give an increase. A lot of times you're told, well, you're gonna have to go to the ER, whatever. Mm-hmm.
Cindy, could you define palliative care and maybe give an example in case people don't know? I'm sure you have it up there.
I do. So palliative care, okay, well, I have this nice little thing here, so as long as okay, so the real definition of palliative care is specialized medical care for people with serious illness. This type of care is focused on providing patients with relief from the symptoms of pain and stress of a serious illness. The goal of palliative care is to improve quality of life for both the patient and the family. It's provided by a team, like I said, but let's see, it can be provided along with home care. Say somebody's coming in to administer fluids or whatever, but the palliative care can do that. So, what's the difference? What is hospice? Well, hospice is care by a whole interdisciplinary team for patients who typically would not be expected to be here 6 months or less. None of us have a crystal ball. It just means there's no more treatment. And, okay, so you meet the criteria. I'm going to tell you, I had a patient a number of years ago, back when Obama was first running, right? This lady, I was case manager down in the cities, and she lived on Rice Street. In September, she was found to have lung cancer, mets to bone, and lymph node. Her doctor said, you need to get everything in order. It's very advanced, very fast, growing. She said, tell me I'm going to be around for the election. And he said, you can always do an absentee ballot. No, you do whatever you're going to do so I can be here. Well, okay, so she was given yep, this is going to go quick. Story goes on. This lady, yes, she was around for everything for the election. She had a scooter. She was up and down Rice Street. She'd go to the library. She was at Dar's Scoop Shop. She decorated for every holiday. Christmas came. She decorated to the hilt, gave everything away. Okay? Now this goes on for the next year. Easter, Halloween, you name it. Christmas comes. She's still here. And having very good quality of life. She lost the field of vision because of where tumors were, but I'm telling you, she was alert-oriented, had our services. Well, she bought more Christmas stuff, not a lot, and she gave it all away. Okay, the next Christmas comes. She had somebody decorate the outside of her home because she wanted to be a part of the drive-through decorations and everything. She said, I know I won't be here the next one, but the biggest of everything. I'm telling you, she had she had these high ceilings, and then she gave it away. Well, there is a place in St. Paul called Our Lady of Peace, and it's a hospice facility. Years ago, it was run by the nuns, the sisters. There's 8 female beds and 8 men. I always say there's none nuns that are specific to teacher, nurse, whatever. So now it's regular nurses that work, but they take care of male and female. Anyway, there's no charge for it. It used to be where it's the only facility where there's no charge. It used to be just for cancer patients. Now it's open. It's for hospice. Well, this patient said, it's too soon. Most people go there and they're only there for a couple weeks. And I said, but you need more help. You just don't have it. Yeah. She was 4 months there. So this is the diagnosis that meets 6 months or less. And she was around for 2 years, 2.5 years, something like that. Okay? So nobody knows. We're all one day closer. But it's about comfort and support. Okay, so the rest on my hospice here. Care is not focused on cure, but rather aggressive comfort symptom management and end-of-life concerns. There's bereavement that follows for 13 months after somebody passes, and there's one-on-one available if need be, quarterly mailings, twice a year we do a We Remember. They're pretty emotional because when you're with people, and this is what I do, people say, how can you do, this is doom and gloom. And I said, no, it really isn't. To know that there was really good quality of life, it's very rewarding. But we ask that families send in a picture if they can't be there. And for us, it's like, oh my gosh, yes. And you do this and you see all these, it's, pretty emotional. So the care is geared towards assisting patients and families to navigate this part of their journey. So, let's see. The other thing, what was I going to say? There was something there. If somebody normally went to Texas, we got a lot of snowbirds here, we say, you can go there. We transfer, we collaborate with a hospice in another place. I've had a patient, very young, with throat, neck cancer. They wanted to go to Hawaii. She had a feeding tube. We made sure every island she was at had tube feeding for her, so they didn't have to, it was all there for her. And they had a wonderful time. So we say, if you can go, go. If it's a real nice place, bring me with. But, so again, we don't speed up, we don't prolong. Let's see here. So, palliative care, it's all about comfort, support, but just not where there's no more treatment, okay? Now, some hospices will allow blood transfusions. We are one. Others say that's too aggressive. I will say if it's somebody with leukemia, this is one of the hardest because they're receiving packed platelets versus just packed red blood cells. Platelets are considered aggressive because you usually have it 3 times a week. So when they can no longer get out, we have them. We don't have them very long. But, so we offer that. We don't do an x-ray. We don't. So with your nurse, getting to know what your lungs normally sound like, you start coughing up something green, we just go by, do you have any allergies? And we have an antibiotic delivered. There is proof that people actually live longer in hospice because of how fast. So you think of yourself, if you've had a cough and, it's like, okay, it'll get better. Okay, try to get in the next day, now you can't. Then the next day, well, it just keeps going. Kind of like, urinary tract. Burning, I'll drink cranberry juice, maybe it'll get better. Well, for us, we don't need the urine specimen. We literally start you on an antibiotic. If things aren't better for like a urinary tract infection in 24 hours, then we might gather one to make sure we're on the right one. But for the most part, people do better just because meds are given to you right then. So we don't take away hope, prayers, nothing like that. We come to you and just no more scans. I have had patients say, some gentleman, a prostate cancer, and he's been getting an injection every 3 to 6 months. And I will just say to him, you know what, sign in. You can sign out faster than you did sign in. Signing in, we got all kinds of things. You'd swear, you bought a house and a car, and the paperwork's kind of crazy. But signing out, it's literally just, it can be a phone call saying, you know what, we are going to the hospital, we're doing this in the event of a fall. I always tell people, I can barely sew a button on, so I would come with Gorilla Glue or duct tape. So you have to call us and say, then we call the ER, give them a heads up, and you do go in. Now, if you don't call us, it's duplicate billing, especially if you're admitted to the hospital. When you sign on with us, it is kind of like signing over your Medicare to hospice. Doesn't mean we take any of your Social Security, nothing, but at that money, we get paid a per diem, and I have no idea what it is, but if I just say it's $100 a day, I don't know. That includes all the visits, the medications, the equipment, all that kind of stuff. So that's where Medicare is paying. If you go to the hospital, that's aggressive care, especially like a congestive heart failure. You're filling up. Well, we do a lot of these, so you should call us first, but you can revoke and you can come back. So, back to the prostate, I will say, okay, you're not having another injection for like 2-3 months. Sign on. You can always sign off because you have more to gain right now than thinking about that next injection, okay, because we don't cover it. We meet you where you're at, meaning your home, nursing home, assisted living, or homeless. I have, my lovely years, I had a patient. We could have got him a place to live. He said he was going to die under a bridge or in the alley. So we provided him with a cell phone. He had to pick up his meds at a place on Rice Street called People's Incorporated. And he carried a backpack, very much a loner. He said, I may be an alcoholic, but I've never been a drug user. And he guarded his narcotics, everything. Well, we would set up and we'd meet him in a park, whatever. Medical director would make a visit with me and Jim would say, can I give you guys a beer? And the doc would say, well, it's a little early. Jim would say, next time, come a little later. So, anyway, this man, he did get his wish. Somebody found him, thought this person had passed, didn't know who he was, called 911. I got a call from Regions Hospital saying, Jim? I'm like, yep. And they said that he had passed. He hadn't told me the story. So we met him where he was at. Had one that had a U-Haul closet, one on a boat, Stillwater. So we come to you wherever you happen to be. Okay, so it goes on here. So, okay, the palliative care team. So I have, I do have good information on this. Who can benefit? Any diagnosis at all. I say life is one day at a time. Payment, you will never, like Medicare, you will get an explanation of benefit in EOB just to keep us honest, to say that, oh, you were out there 7 times this week? No, my nurse was only out there twice. So anyway, it's just keep everyone honest, but it's covered. So any insurance, medical assistance, I always say you have more to gain by hospitality than not. It's not something to fear. We're not getting out of here at end of life without dying. We're all one day closer, but that doesn't mean we have to live in fear. So there's so much support. Other things we have are, massage therapy. And a lot of times patients will say, I don't want it. And the wife will say, I'll take it. Well, unfortunately, it's only for the patient. But they'll do about every other week because we don't have as many. It's a complimentary therapy. It doesn't cost anything. We have music therapy. They come out, guitar, keyboard. One new thing we have is, you know how when you hear the first heartbeat from an ultrasound or whatever of a baby? Well, we do the heartbeat and put it to a song, and it's a keepsake. I'm telling you, I had tears galore. And I say the day, I try to be the tough one, and I can tell you, a lot of times I'm trying to talk, and I'm the tearful one. So I don't know. But I say the day I callous, I don't belong to it anymore. So, but anyway, so music, massage, Reiki. We have volunteers. Volunteers are wonderful. However, with the COVID, they have not been given the okay to go back into the homes. Volunteers, we're hoping shortly here, write letters. They can be just bedside. We have some that are 11th hour volunteers. So say someone's in a nursing home and they really don't have family, but they are there, so it's one-on-one, somebody with that person or whatever. Caregiver relief, they can't give any meds or anything, but the caregiver can go out and run errands and whatever. They bake, cook, some do mowing lawns, shoveling. Some do memory boxes. And then included in the volunteer is pet therapy. Everyone knows, you've seen all the stories on the news where different dogs won't even leave a bedside, and sure enough, that person, so they can really be calming. Some cats as well. All the volunteers have went through a program, so it's like a 3-month program, and their background and everything. So, they're wonderful. They got to come back soon because they're really a nice complementary therapy. Some of the volunteers do, it's called Do Re Mi, and it's just music therapy, some special. Some do Reiki. So every hospice agency has their own certain. Obviously, I'm from a big company, so probably more to offer than others, but no matter what, I just say, hospice is really good. All right. Energy, healing, okay. Hospice, the team, there's 2 doctors. There's your doctor and our medical director. It takes 2 doctors. You get a referral from your doctor. Sometimes your doctor will follow. Sometimes people take our medical director. Most of the orders come from us anyway because we're available. Weekends, round the clock, a little different. Nurse case manager, massage, music, the medical director, the hospice aide, bereavement. When I do an admission, I'm already assessing for what's the level of bereavement here, how are people coping? So I've just recently had one where, we just say, it's okay. You don't have to sign a POLST, which is going to be discussed next time, the Provider Order of Life-Sustaining Treatment. Do not resuscitate, do not intubate. You do not have to sign it, but it's good to talk about it so your family kind of knows. I'm going to give the example of like the Hmong population. Again, my years go back to St. Paul, and I might have them mixed up now, but if you were from the mountains, we knew that you could not die at home. So when things are looking, you're going off to the hospital because they were worried the spirits would stay in the home. If you were from the valley, you had to die at home because they believed that if you went to the hospital, they were going to take your eyes, your organs, and all this stuff. So that was all made clear. The other thing is they would never sign a POLST. That's like saying, it's okay, you die, it's okay. So we would just say, when you are 150, 200 years old, do you want to be at home or a hospital? Or a little different way of, we used our interpreters. And yet, when their loved one, they wouldn't necessarily tell me they transitioned. I would walk in, and there would be 100 people in the house, and the person would have their black gown over them. And I was like, yep. And they weren't sending them anywhere, so got to learn a lot. I used to be able to speak a little bit of Hmong, but I've kind of forgotten. Is that true? Anyway, okay, social worker volunteers. That's kind of that team. Okay. As I was saying on advanced directives, even if people don't have a healthcare directive, we do have the 5 wishes where a social worker will just sit. I was going to bring one, but I know they'll probably do that next week anyway, or the next one. It's just where you can talk, Would you want cremation or burial? There's a big one. And it's just brought up. A lot of people have never talked about it. Something we're just not going to talk about that. And all of a sudden it's like, well, I don't know. Okay. What else do I need here? Oh, we honor vets. Big program. We do a vet-to-vet pinning. It's pretty emotional, and it's the whole team. They get a pin, and it's a whole little ceremony thing, and I think all hospices are doing that right now. I know we've been doing it for quite some time. What else do we do here? Let's see. Well, basically I say live life to the fullest, comfort and support. Tomorrow's not promised to anyone. We're all one day closer to end of life journey. Hospice does not speed up end of life, nor does it prolong, but rather is with you and your family on the journey, and then peace. Memories are forever. So, one more, aromatherapy, all that stuff, all your essential oils. Fairview is given a grant. Right now, it's probably been about 10 years ago, and some people didn't want narcotics, whatever. But for some it works, some it doesn't. But the different essential oils are wonderful. They help with sleep, they help with nausea. And we provide it where they just kind of breathe it, but we had to fill out, did it help? What did you do? And anyway, now everybody's using it, and it's just a part of the whole hospitality program. This little insert here is, the support, the relaxation, suggestions on what to eat. Don't force. You're going to eat. If you're diabetic and you want to eat a lemon meringue pie, then eat the whole thing. Just don't check the sugar. You know it's going to be up, but it's okay. It's okay, especially when you're not eating. If you're really not eating much, well, then we usually encourage just stop checking, because any kind of checking sugars is to protect your kidneys and everything, for many years, but when it comes down to end of life, it's like it's not going to make a big difference. So, okay, quality of life versus quantity. Sometimes we get people and they just know they want no treatment. Okay, fine. And some of them, we get them so very, very ill because, of chemo and everything. And to each their own. A lot of times I say, we'll do some different meds, and we really do. We use a lot of different meds. I call dexamethasone a steroid. I call that vitamin D. I tell you, it does a lot of things. Increases appetite, takes down inflammation, helps with breathing, helps with nausea. The downside, if you're going to play for the Vikings or the Twins, you're going to test positive for steroids. But anyway, other than that, so we really, without labs, if there's a lot of swelling, my gosh, we are going to initiate meds. Doesn't mean giving up on you. So I just say, don't fear it. People actually do better. With hospice in Medicare, there's also 3 other benefits. If we have a symptom we can't manage, we have said, let's do this, this, this. It's called continuous hour of care. And that's where a nurse goes in, and every hour they're in contact with the physician, and they're the ones given the meds, so family doesn't have to feel like, I feel like I just overdosed someone. If that isn't working, there's general inpatient level of care. Doesn't have to be used a lot, but it's ordered by our hospice medical director, not your family physician or oncologist. And it's symptom management. And then the last one is respite care. The benefits are 3 months, unlimited 2 months. So 90 days, 60, whatever. Per benefit period, there is respite care available. So kind of in an Alzheimer's situation, it's really a nice thing. Caregiver burnout or whatever. Or maybe you have to go to a wedding in, Arizona, and your loved one can't go. They go to a nursing home or hospice facility, and then everything is covered, and it's for, 5 days, 6 nights, 5 days, I think. And that, even if you were the diabetic, that we weren't covering insulin, everything's covered. So, and it's per benefit period. Questions? Okay. The myth is hospice means giving up hope, and the fact is that it helps patients and families reclaim the spirit of life, focusing on quality to allow the best days of time left. And as I said, they do actually live longer in hospice. Some graduate, and that would probably be more, again, your Alzheimer patient, who, when we get them in a nursing home or whatever, they have lost a lot of weight. Well, the dementia continues, and now they're allowing someone to eat, and actually they're getting ice cream, everything. They're eating all the time. They're gaining weight. They don't meet criteria anymore because they're custodial. But if they aspirate or have an infection or something, then we come back. So you can revoke, but we can also discharge you. So, lastly, the death doula. I was asked by Darlene to kind of reference. I can tell you I don't know a whole lot about it. I do, but I don't. I know of one gal in Malacca who was a death doula. Basically, it's a midwife. Everyone has heard of the birthing doulas, you know, they're there and they coach you through and all this. So, to be a doula, it's actually mostly online. You can get yourself certified. State of Minnesota has programs, and depending how far you want to go. So they help with home funerals, natural burials, advanced directives. They're there following patients' wishes, being their advocate for carrying out their needs and wishes, spiritual and emotional support. It's not covered by insurance, but anyone can become one. Now, if it is the administration of certain things, you have to be the nurse who took the certificate course, but otherwise anyone can, and it's actually going through so families are aware of what are your wishes. I like to say we do that in hospice, but it has been probably more in the cities. You hear of them that they're alongside the hospice team. So, home funerals. Yep, I got introduced to that in St. Paul. The Irish wakes, by law, you have 72 hours before the deceased has to be picked up. So I've had it where they've had home funerals, and I went in and there's a big banner on the door and food and music and people, and the person's laying there, blankets up to here and pictures all over, and I don't know. I've had where they've done it in a 3-season in the winter, 3-season porch, and it's cool, and all the candles, and they have it, and so we have lots of options out there. So, questions?
Thank you, Cindy.
Mm-hmm.
Any questions?
Would you explain what Reiki is?
Reiki, okay. Well, it's without touch. It's moving the energy, and you know, those that are trained in Reiki. So let's see. So I think I even have something on here. Where do I got it?
It's kind of like a yoga almost, but
It's-
without touch.
There isn't touch at all. And it is, you know, there's meditation, yoga, whatever, but it's just a calming, moving, but some will say your chakra is definitely, you know, not doing well, and it's a calming, and yeah, so it's used, and it's
I have a girlfriend that does it.
okay.
And when she first said Reiki, I went, isn't that the name of the lion or the animal from Lion King?
It's funny. You know, I myself used to have migraines, and when I was told to go for acupuncture, because that's another, some people, you know, will do that. We don't provide it. But I was so thinking, this can't work. And I laid there, whatever, and it's like, well, maybe I was better. And I happened to reach back, I'm like, oh my gosh, there's a pin in me. But again, I just wasn't, I thought, nope, that isn't gonna work. Well, for some, that does work, so. Does this open your eyes? I mean, I do have, you know, I can leave like the side-by-side comparison. Home care, say you just had a knee replacement. It's a short duration. You have to be homebound. So therapies, palliative care, you have to be homebound, but you're still going out for treatments and stuff. You can do that. It's a taxing effort kind of thing. And then hospice, we meet you where you're at. So.
Thank you. So during the pandemic, my mom came and lived with us, and we placed her in hospice. And so part of that learning curve for us was finding who services this area.
Yep.
And so I would just encourage you that if you already know that this is a road you're going to be going down, or if you start on that road sometime, to explore your options. And sometimes because of capacity, they're not always accepting new patients. We had a wonderful experience, but it was interesting because it was started in the first 2 months of the pandemic. So there was a lot of learning going on of just what that was going to look like, but it was such a blessing to our family. So, but I only know up here, I only know of 2 or maybe 3 options that exist up here compared to the cities. And maybe there's more and I just didn't research the best places, but do you know how many serve this area?
I'm really, really not sure. I do know, I mean, I know we have, so there's obviously Onamia, and there's Heartland of Brainerd, there's Good Samaritan out of Brainerd. What's one, Aiken? I thought Aiken had something, but anyway. What is it?
I wondered if there was one tied to the hospital up there, Riverland, but yeah, we interviewed the Mille Lacs and Northland and Brainerd is who we.
Okay. So.
Yeah, and we did it sort of like a job interview, right? I mean,
I agree.
you're going to have them into your home. You want to know what their benefits are, what their policies are,
Yeah.
and both places were seemed very willing and comfortable to be interviewed. So
Yep.
it was.
We do
That's good.
consults all the time. You know, it's like, well, the doctor thought maybe you're still even receiving treatment or whatever, but it's like, you know what, let's just open the door. So we go and just present what's out there whenever you're ready. So, and a lot of times I know that I may have a 1 o'clock, but I know at 3 o'clock another one's coming, and you know, and that's fine.
Okay. Well, thank you so much, Cindy, for sharing all your knowledge and experience with us. We greatly appreciate it. And I think there might be some soup out there. Otherwise, so there's soup for folks to share.
Okay.
Feel free to join us, or if you brought a lunch. And
at
otherwise, we'll look forward to see you April 20th for our final series in the session in the series.
Very good.
Thank you.
And I can leave that, I mean, if you want to take it in there where they can even look at it or whatever. And like I just have different information, and as I said,